Good morning, Chicago. Today is March 14th, 2023. And as always, thank you for joining us. This is your opportunity to get your COVID questions, but also your broader public health questions answered live. You can use the hashtag AskDrArwady. You can put it directly into the box below or use that hashtag on either Facebook or Twitter. We don't have any guests today, so we're really just doing a look back on COVID. We are, of course, this week represents the 3-year anniversary of a number of the things when really the whole world changed 3 years ago around COVID, and we've gotten some questions and reflections in on that. But just looking ahead a little bit, so next week, Tuesday at 11, we are planning to do some additional focus on behavioral health. That's our mental health, substance use, and violence prevention work. We won't have Facebook Live the next week, but then the week after that, we're actually going to have a focus on sexually transmitted infections. Our team has been doing a lot. Again, that's one of the things that's gone a little more under the radar. COVID has upended a few things there, and certainly some very interesting things happening in the world of sexually transmitted infections. So just to kind of lay out for you a little bit over the next few weeks. But today we are going to really take a look at COVID. We'll probably do a relatively short and sweet Facebook Live here, depending how many questions you all ask. So let's turn to our COVID dashboard, chi.gov/COVID-. We do continue to update this. I've got a whole team at CDPH heavily involved in making sure that all of our monitoring is continuing, and we are watching for any signs of warning signs. But I'm happy to say that right now, all things continue to look good from a COVID perspective. COVID's not over, but we're in this really different place. So to put some numbers on it, we're averaging about 320 lab-confirmed cases in Chicago residents every single day. And those are just people getting a formal test, meaning generally they're going to the doctor, they're going to the hospital. We, of course, have hundreds and really thousands more Chicagoans that are still diagnosed every day through at-home tests. But that laboratory confirmed cases you can see is low and has remained generally low these last few months. In terms of hospitalizations, we're also in a pretty good place there. Not done, though. There are 25 Chicagoans every single day still being admitted to the hospital with COVID. And that also is low compared to certainly some of the big peaks that we've seen historically, but it is not gone. In terms of deaths, similarly, we're still at less than 1 death per day of Chicago residents from COVID. 8,079 Chicagoans have died from COVID since the outbreak began. And largely, I talked about this last week, the deaths that we're seeing tend to be in older Chicagoans at this point. Yes, we have still seen in recent weeks, we had a Chicagoan in their 30s die from COVID, but most people are in their 70s, 80s, 90s, even 100s at this point. And it's essential that anybody over the age of 50 or who has serious underlying conditions stay up to date with your vaccines. But then if you do get COVID, make sure you're taking the medications that help stop the virus from copying and help stop you from getting seriously ill. We're averaging about 800 COVID vaccinations every day in this city still. And we're less than 2% of our emergency room visits and about 3% of our hospital beds are taken up with COVID. I'll just remind you, down here is where if you want to look at more details about community risk and transmission, hospital capacity, wastewater, variants, local vaccine coverage, local vaccine effectiveness, or social impact, you can go there. But also, I just wanted to remind you that up at the top here, we do still have a lot of other data available. So if you want to see more about what's happening with cases, if you want to see what that looks like, historically, if you want to change See what that looks like by race, ethnicity for hospitalizations. See what that looks like for deaths. See what that looks like by gender. You can continue to, we are updating all this data. We don't intend to stop anytime soon. You can either look at cumulative totals where, for example, there have been more than 51,000 COVID hospitalizations to date between March 1st, 2020 and March 8, 2023. But then if you want to go to daily averages, it will default to where we are now, 25 hospitalizations on average. And then if you want to dive down into that, if you look by age, for example, you can see that the highest hospitalizations, like I was saying, are in those in their 60s, 70s, and 80s. And if you want to look by race, ethnicity, we are seeing still higher rates of hospitalization and deaths, particularly in Black Chicagoans, followed by Latinx Chicagoans, Black Chicagoans, followed by white non-Latinx Chicagoans, followed by Latinx Chicagoans right now. And of course, that we've seen that change over time. But you can explore if you want to look at more statistics. That's the place to do it. If you want to look at geography, we continue to update this. Here's what we're seeing in terms of COVID metrics by zip code. This defaults to deaths, but if you want to see formal laboratory testing, if you want to see cases, again, you can explore that. You can click on any of these areas and it'll show you what's going on in this neighborhood compared to what has been going on historically. You can look at weekly totals on this or cumulative totals on this. So for example, in this area of Chicago, in the last week, we had no deaths. We had 2,717 formal lab reported tests, and we had 85 cases within that. And you can see what the changes look like. So lots of things to explore there. In terms of tests, this is looking at, what are positivity rates. We're doing about 10,000 average tests. If you want to see vaccines, here's sort of the citywide view on this, and you can break this down by age, by gender, by race, ethnicity. And then if you want to look by zip code at vaccine, that is all still here. I'm happy how dark all of that is in terms of those initial vaccines. So we sometimes get questions, where do I get this number? How do I find this? And I just wanted to remind you that that is where it is. So let's go ahead and I'm going to move into the just a few of the slides here. So first of all, it is St. Patrick's Day, of course, on Friday, and the team had put together just a little bit of messaging, some lighthearted messaging around St. Patrick's Day. We don't want you to get sick. There are things that should be green on St. Patrick's Day. The river, maybe your beer, maybe your hair, but not you. And that goes beyond COVID. You really should please stay home from festivities if you're sick. Do wash your hands frequently, as we've seen some more spread of some of the illnesses that can make you sick to your stomach. We encourage people to carry a mask. You want to have that with you. If you find yourself in a crowd, you find yourself next to a coughing leprechaun, you want to be able to pop that on. And then stay hydrated, really, with water, not beer. You want to be alternating water if you are drinking alcoholic beverages and just paying attention to that. So just a reminder as we head into St. Patrick's Day of a few easy things to keep in mind. When we return to COVID, our local risk here is still low. That's very good news, and you can see that we are well below the thresholds for the three metrics that are used nationwide to make those low, medium, or high assessments. So just to review this, we make that determination based on how many new lab diagnosed cases we have per 100,000 population in the last 7 days. We want to be less than 200. You can see both in the city of Chicago and broadly in Cook County, we are well below 100 there. If we look at new COVID hospital admissions per 100,000 population in the last 7 days, our goal is to be less than 10. City of Chicago is about 6.5, and Cook County overall is about 8.8. So that's the one we're keeping a little bit of an eye on. If that were to get back above 10, we could move back to a medium level of COVID risk, but we're a long way from high. And then finally, the percentage of staffed inpatient beds here in Chicago and in Cook County occupied by COVID patients. We want to keep this under 10%, and you can see at both the city and county level, we're right around 3%. So everything is looking good. And we're in good company here, being at low. So on this map, every county in green is at a low COVID level using those same metrics. About 16% of counties are at a medium level. You can see that Illinois has a number of medium counties this week, but Illinois doesn't have any high counties, which is good to see. And just 2.5% of U.S. counties report a high COVID level. Generally, we see that where hospitals can start to get stretched or there's some sort of local focused outbreak going on. And more locally, just pulling some data from the dashboard, there's been no clear trend in geography of a change in cases here in Chicago. We continue to see highest case rates in the past 2 weeks in the Southwest and in the West. Some of that has to do with some of the differing testing patterns where people are coming in to federally qualified health centers, coming to doctor's office to get tested. But generally speaking, we've not seen any major changes or major surges here. The colors on the right just show you a community area in green is less than, it has dropped, is more than 20% less than we were seeing in the 2 weeks prior, whereas the ones in red were more than 20% above where we were in the 2 weeks prior. But overall, no major patterns of big concern geographically within Chicago. And when our epidemiologists in Chicago look at our local data, SARS-CoV-2 spread, meaning COVID, is largely stable at this point across all age groups. It is even possibly decreasing a little bit overall. And we look at that across emergency department visits in blue, hospital admissions in red, and cases in purple. So the news here really continues to be quite good in terms of no signs of major surges on the horizon. Variants, of course, are the big question factor in all of this. Just as we expected, that XBB.1.5, which is a subtype of Omicron. All of these letters and numbers here on the right are all subtypes of Omicron. That is the one that emerged in the East Coast and, just as we expected, has been outcompeting everything else here in the Midwest. And we are now up to more than 90% of the cases that we see here in Chicago and, in fact, across the Midwest being Omicron subvariant XBB.1.5. And if you look at the U.S., almost everything is that bright purple, that XBB.1.5. The good news is we've not seen a new variant emerge of concern. And so when the team looks at the Chicago lab-based early alert signals, we're looking at variants. We're doing a variant risk assessment, both how quickly are variants growing, and then has there been a variant of concern designated. And then we're looking at the average wastewater risk score. We do these every week. And this week, in terms of variants, we're still at a medium level, which is where we've been. There's a little bit of detail down below there just to give you a sense of what the scientists at the Public Health Department are monitoring. There's 4 different subvariants that are currently increasing in prevalence locally. The only one that is at even a medium level of concern is that XBB.1.5, just because it's been doubling fairly quickly. It's been doubling every 8.8 days, and not unexpected, not moved to a high risk. The other ones that we're watching, all at this point, are of low concern, and the doubling time in all of these is more than a month, meaning that they're not showing signs of outcompeting or being a major problem on the horizon. Quickly on wastewater, we often get questions when we talk about wastewater, and I thought I'd just bring a few more slides showing you what we're doing here in Chicago with a lot of partners to really understand what's happening with COVID and other diseases in wastewater. So every week we calculate a low or a medium or a high level, and you can see that in this most recent week, we've actually dropped back down to a low level in terms of COVID. And we were medium last week and low the week before that. And the data that feeds that is both at the what we call the treatment plant level on the left, wastewater treatment plants, and then sewer sites on the right. And so the wastewater treatment plants, there's a lot I didn't know about wastewater before I started looking at this, but all of your water, if you live in the city of Chicago, gets treated at one of 3 wastewater treatment plants. There's Terrence J. O'Brien in A there, that's the north side, not just for Chicago, but for a lot of the suburbs. And then there's Stickney, which services the middle part of Chicago and then a lot of the suburbs west. And then Calumet, the southern part of Chicago, and a lot of the suburbs west and southwest. And so there is work that looks at the level of disease at the wastewater treatment plant level. And that, of course, is millions of people, actually. And so the numbers will be different. But overall, we're seeing a low level of concern on the north side. We're seeing just a medium level in the middle at Stickney, and we're seeing a low level at Calumet. And really, it's only if we were to see high that we have significant concern. The low and the medium more just represent different levels of community spread, which we know community spread is ongoing, of course, in all of these areas. And then on the right, we've been doing more with these sewer sites. In addition to the high-level wastewater treatment plant that literally catches everybody in Chicago, to have a little more nuance and to really understand how to use wastewater data, we also work with partners to collect wastewater at currently 8 sewer sites. You can see they're spread across Chicago. They're in each of our equity zones, and it gives us some ability to collect data and understand patterns at a more hyper-local level. And you can see this week just one of the sewer sites, the one in Lincoln Park near Northside, hit that higher level, and everything else was at a medium level. So again, a single sewer site doesn't give us significant concern, and overall things look good from the wastewater level. And so when we do calculate this wastewater metric, there's an average wastewater score that is both looking at how much change we're seeing in wastewater, and then also just the overall level. And so this low risk score does indicate some decreased community transmission in Chicago. And that's consistent, of course, with what we're seeing in cases, hospitalizations, and deaths. And we're still learning about wastewater, but it's good. And just to give you a sense of this, we also are looking at things like influenza. And in this case, both at the treatment plant level on the left and then the sewer sites on the right, everything is low influenza, both A and B risk and level at this point. And in fact, we had several sites that didn't have any detection of influenza. So that is matching what we are seeing in the clinical data. Influenza really is at a low level right now. Thank you, everybody who did a good job getting your flu shots this fall, just in terms of helping us keep flu under control while we work to keep COVID under control. So just wanted to give you a sense of some of what that science is. A reminder that if you test positive for COVID, nothing has changed. You need to stay home for days 1 through 5. That's regardless of your vaccination status. If you're at high risk for severe illness, talk to your doctor about getting early treatment. From day 6 or later, you can end isolation as long as you're improving, but you do need to wear a mask around others days 6 through 10. And then I mentioned this briefly, but I really want to underscore Vax and Pax. That's our belt and suspenders. Vaccination and Paxlovid, or the other medications. Just Paxlovid is the one that's used the most. If you're at high risk for severe illness, vaccines are your best protection against COVID-19. But if you test positive, early treatments are available and effective. So Paxlovid is one example of an oral antiviral therapy for the treatment of mild to moderate COVID. And the idea is anybody aged 12 or up at high risk of developing severe illness is eligible. Now, really, most kids wouldn't need to take Paxlovid. But if there's someone who has a significant immunocompromising condition, et cetera, they should. And we want folks talking to their doctor about this. If you're over 50, really, in most cases, I would recommend that you take Paxlovid, because what it does is it stops the virus from copying in your body. It helps keep you from getting seriously ill. We are still learning about long COVID. We are still, it is not always a totally predictable virus. And so for people who may be older or have underlying conditions, really the data keeps looking good here on using those oral treatments if you have a breakthrough infection. And Paxlovid is available and recommended regardless of your vaccination status. So if you're totally up to date with vaccines and you get breakthrough COVID, I would recommend Paxlovid if you're at higher risk for severe illness. if you've never had a vaccine and you get COVID and you're at higher risk for severe illness, I would recommend Paxlovid or one of the other meds. So you can go to chai.gov/therapeutics to learn more. These have to be prescribed, so you do need to talk to a physician or a nurse practitioner, somebody in a clinical setting, or there are pharmacies that are set up for test to treat, and we have more information on our website about that. Here's how we're doing on booster coverage in Chicago. We continue to exceed the national average, but that's not really that much to brag about. Just 1 in 4 adults over the age of 18 had their fall booster last fall. That was the updated vaccine to help protect you against Omicron. So we're keeping an eye on this, especially those over 65. You need to get that updated vaccine now, honestly, if you haven't. I was seeing patients in clinic this last Saturday, and I saw a number of folks who were over 50 with underlying conditions who just hadn't quite gotten around to getting that updated booster. In some cases, I think people didn't even realize they needed to get another vaccine if they'd had their vaccines early on. And so, I make the recommendation, we do the vaccine on the spot, but I do just want to emphasize that especially those who are older and especially anybody over 65, it is not too late. We're still doing about 800 vaccines every day across this city, and there have been more than 584,000 doses of the updated booster coverage that became available last Labor Day since authorization. I also just want to underscore that we continue to update this on the website, but just since Omicron became dominant in Chicago, infection rates in Chicagoans for COVID have been almost twice as high in those who are unvaccinated compared to boosted. And that's regardless of whether you've had COVID before. This is purely vaccination status. And you can see those red lines here show the rates of infection in those unvaccinated compared to those who had their first shots compared to those who were boosted. Since the Omicron variant became dominant in Chicago, unvaccinated Chicagoans have been 2.3 times as likely to be hospitalized as those who are boosted. So more than twice as likely. Being up to date with your vaccines cuts that risk more than in half, compared to unvaccinated. The vaccines make a difference. They're safe, they're effective, they're free and widely available. And then finally, deaths. Mortality rates, just since the Omicron variant became dominant in Chicago, Chicagoans more than 5 times as likely to die if they get COVID if they are unvaccinated compared to those who are boosted. And the booster really does show up differently here. You can see that people who got their original vaccines but didn't get a booster, where we look at that data over time here in Chicago, have been about 2.6 times less likely to die if they get COVID. But look at that with those who are boosted and up to date, it's about 5.1 times. And we don't have a lot of things that cut your risk of death by almost 3 times or especially almost 5 times. So again, important for everybody to be up to date, but especially those who are older, given that that is who is most likely at this point to be hospitalized and to die from COVID. So COVID boosters and flu shots remain widely available through doctors' offices, through pharmacies. They remain at no cost, the COVID vaccines do, and we do continue to operate our Protect Chicago at Home program. At this point, the city is operating it 3 days a week, Saturdays, Sundays, and Mondays, 8 a.m. to 6:30 p.m. But we will bring vaccine to you, to your home in an appointment at a time that is convenient to you. We can vaccinate up to 10 people at once, anybody over the age of 6 months. You can get your families, friends, neighbors together and just do a come up to date with your vaccine party. So we can also still do first or second doses if there are people who have not yet had their initial COVID vaccines. And as long as somebody in that group is getting a COVID booster, we can bring everybody up to date with flu shots also. Just a reminder again that 211 is live. That went live this calendar year. It's a new single number for anybody living in Chicago or in suburban Cook County who have unmet health or social service needs. So it's a single number that you can call if you need help with food, if you need help with learning more about housing opportunities, if you need help with finding a primary care doctor, etc. 211 is now a single number. And as that resource continues to grow, we're really excited to add resources to it. You can also go to 211metrochicago.org. And then we also finally continue to operate at the health department our 7 days a week COVID hotline, 312-746-4835. Give us a call if you have a COVID question, you're trying to find a vaccine, you're trying to find Paxlovid or another treatment. You can also go online, chi.gov/COVIDvax for the most information about Chicago vaccination. So with that, I will end the slideshow and we will turn to your questions. Let me just switch over here. Okay. So there's a comment. So Reb Fry on Twitter had noted, related to some of the posting that we've been doing about being at a low level. Reb says numbers are only low because less people are testing or fewer people are testing. Tests have become unaffordable for many. It's important to analyze this data directly. Friends, when looking at the CDC metric, the CDC website for COVID metrics, be sure to look at how low the numbers have dropped for testing. So thank you, Reb, for that comment. He also is asking to bring back masks to protect ourselves, our communities, and families. Let me underscore a couple things that Reb has mentioned here. So first of all, the reason that I showed you right up front here where you can see what's happening with COVID testing and COVID testing levels is that those are lab confirmed tests. However, those are people who are going to a healthcare setting to get a test. And often those are people who are sick. So these are people coming into the emergency department, coming into their primary care doctor, their federally qualified health center, et cetera, because they are having symptoms of some kind and then being found to have a positive COVID test. And it's not just the testing that's low. That's one of the reasons that we look at metrics like hospitalizations, that we look at metrics like emergency department visits, that we look at wastewater, that we look to see what's happening with variants. So, and then I also just wanted to underscore that just on your comment that tests have become unaffordable for many, tests are still free, okay? If you are insured, if you have commercial insurance in this country, until the public health emergency ends in May, your insurance company has to cover the cost of up to, I believe it's 8 tests per month per person. So you might have to purchase, depending on your insurance, you might have to purchase them at the pharmacy and then submit the cost for reimbursement, or you're able to get them through your insurance company. If you have Medicaid, if you have Medicare, there are pharmacies that are set up for distribution. We also continue to distribute lots and lots and lots of the at-home tests. The CDPH stockpiles them and then distributes them through community partners. We want to make sure, you know, Chicago Public Schools has purchased many of these, makes them available at times of vacation so people have them. So if you're having trouble finding a COVID test, give us a call, 312-746-4835. Also, if you haven't ordered your free test from the federal government, please be sure to do that. And chicago.gov/COVID test has all of that information with lots more detail about how to get a free test. COVIDtest.gov is where you also put in your address to get the free federal test. So I really want to underscore that there is testing still available, that an at-home test is absolutely appropriate. It's what I use, and we have lots of ways to measure diseases besides the official lab-confirmed tests, but they are one of the things that we follow, but just one. So thank you for raising that. Karen Grubely from Facebook says, I had my last booster of the updated vaccine in October. Is it about time to get another booster? And she says, thanks for all you've done. So Karen, you are up to date. You and everybody else, this is really the question, honestly, that I am still getting the most. When do I need to get another booster? And here's the good news. Let me frame this for you a little bit. So all of the vaccines that were happening prior to Labor Day, this last Labor Day, all of those vaccines, all of those boosters were with a formulation of the COVID vaccine that was developed, thank goodness, against the original version of COVID, right? The version that emerged in Wuhan, and that vaccine has been incredibly important to help prevent illnesses, to help prevent hospitalizations, and to help prevent deaths. When Omicron hit us, though, in terms of the big variants, that was over a year ago now. That was last sort of November, December-ish, and really showed up in a heavy way last December and January. When Omicron hit, it was so much more contagious than any variant that we'd seen before, and it was making people sicker again, et cetera, that there was a decision made when all the scientists were looking at the data that we did need to do an update to the vaccines to help people have better protection against Omicron in particular. The excellent news is that the protection against severe illness, those hospitalizations and deaths, has continued. It drops off somewhat, but we've seen pretty good continued protection, especially in people who don't have underlying conditions or who aren't older, even in people who had the original vaccine. But that updated booster that became available last fall is the last time that we have updated, the scientists have updated the COVID vaccine. So if you got your vaccine in September, October, November, December, January, February, or March, and you got the updated COVID booster, which is what you would have gotten, you don't have to ask for it specially, that's what you would have gotten if you had gotten your original vaccines prior to that, you are up to date. And there is not a recommendation at this point for anybody to get another booster. This is different than where we were in the first year and a half or 2 years from when vaccines were available. When we were seeing more waning immunity, we were seeing much more new emergence of alpha and beta and delta and gamma and, all of these new variants. Omicron is the last major variant that we have seen emerge. For more than a year now, all of these subvariants, these B115, et cetera, all of those are just different flavors of Omicron. That's the best news out there on COVID, because everybody in Chicago, just about everybody in Chicago, except maybe some young babies, has learned a COVID lesson at this point, right? You've either learned it through vaccination, your immune system has learned how to fight off COVID, how to protect you, especially from severe illness. You've learned it from being infected, or both. There are differences there. The reason that I show you some of that difference between folks who are unvaccinated versus boosted is that we do see additional protection in folks who are up to date with their vaccine beyond what they might get from having recovered from COVID. But regardless, one of the big reasons we're not seeing the massive super spreader events like we were seeing before is that we haven't seen the virus change dramatically in about 15 months. And we don't have whole pockets of the population that don't have those immune lessons, that don't have some immunity. And so I always have to put a caveat on this, because if we've learned nothing in 3 years of COVID, is that COVID can continue to throw us curveballs. But the curveball that everybody's the most worried about, which is the emergence of a new named variant, we've not seen a sign of that at this point. And I'm really reassured by the fact that we've seen a lot of ongoing transmission, not just here in Chicago or in the US, but around the world. But we've seen relative stabilizations on the virus's side. And that's the best news out there. So if you've had your Omicron booster, you're up to date, you've had the best protection that's available. And assuming we don't see some new huge variant emerge, my expectation is that most likely we're heading toward sort of an annual booster campaign here. I don't know that for sure. We'll see for what plays out in the large studies that are happening nationally. But my guess is this is going to end up being something like flu in terms of the way we think about vaccines. Every single year, the scientists look at all of the influenza strains that are circulating. Influenza A, influenza B, there's subtypes, H1N1, there's different flavors of influenza. And we create a new booster flu vaccine that becomes available in the US every fall, And the reason why your doctor recommends you get a flu vaccine every year is because that vaccine has been made to be a match to the flu variants that we are expecting to see cause the most trouble this year. And so every fall, you should be getting a flu vaccine. That is true for everybody age 6 months and up. And my guess is most likely every fall, we will probably, at least for the foreseeable future, I would guess we'll probably be doing a COVID booster campaign. If we've seen a lot of changes in the virus, we will probably do a formulation like we did this last fall that is made to better, match Omicron. If things stay relatively stable, it may just be another booster with that same formulation. I do not know yet because we don't know how the virus is gonna behave over the next few months. And it's possible where we look at the data, we might say there's not a need for a booster this coming fall. But my guess is that we're heading toward probably an annual booster, and it'll be, time to get your respiratory viruses. Maybe down the line, we'll see a combined vaccine where you'll be able to get your annual protection for both flu and COVID. This is all hypothesis from me. I want to be clear. We'll wait and see what the studies show, what the national level bodies recommend. But if you had your last booster in October, you are up to date, and there is not a further recommendation for more boosters, and I don't anticipate one at this time. And thank you for asking the question that the most people are asking. Brian on Twitter is asking, what is CDPH planning to do with the settlement funds from Juul Labs? So, Brian, I can tell you were paying attention to the news this week. We shared I think, really positive news that the city of Chicago reached a $23.8 million settlement against Juul Labs. If you don't know Juul, they make e-cigarettes or vapes. And the reason that the city of Chicago sued is that Juul Labs was marketing and selling products to underage youth. And we have ordinances in this city that don't allow that. There's a lot of, we have Tobacco 21 in place, which is for more traditional cigarettes, but you're not allowed to market or sell vape or e-cigarette products to youth or minors. And for those who may not know, Juul only came out with its product for the first time, the vape pens, in 2015. And by 2019, just 4 years later, more than 1 in 4 high school students in 10th and 12th grade across the country was using this product. Like, that is an amazing growth. And frankly, that came from a lot of marketing inappropriately aimed at youth. We had a lot of flavors. I don't think there's a lot of adults choosing bubblegum and cotton candy and gummy bear. And we saw a big uptake in these e-cigarettes. If you look now, more than 2.5 million high school students report that they are still, using e-cigarettes and using vapes nationally. And here in Chicago, high school students report, that they're 10 times as likely now to be using an e-cigarette or a vape pen than they are a traditional cigarette. And the problem is that Juul, in particular, had very high levels of nicotine in its products. Nicotine is designed to addict you, basically. And nicotine is also particularly problematic for the developing brain. So for adolescents, sometimes people think that, they'll use, that smoking an e-cigarette will help with anxiety or depression, but in fact, where you look at the data on this, it tends to make it worse. Not a lot of people know that. And so the point is that in 2020, we had a lot going on in 2020, but the health department was part of a lawsuit. I gave a deposition. Many other people who work on tobacco and youth, both now and historically, gave depositions, and we came to the settlement. And so what that means is that CDPH is going to have funding to work on youth vaping in a way that we've not had. So we'll be able to do much more with education, working with schools, making sure, young people themselves, but also parents and teachers are having supports and connections. We need to do some more work around cessation supports, helping people who have become addicted to e-cigarettes, helping them quit. We need to work on the data around this. We'll probably be doing some media campaigns, which have been quite successful on the traditional tobacco front. We had almost gotten rid of youth smoking, like honestly, like regular tobacco cigarettes, down to historic low levels. And I think, frankly, the big tobacco was losing its audience, was losing its market. And this was a way to get around some regulations, I think, and frankly, look to get a new generation hooked. And I'm just, I feel really strongly, especially about that risk to kids. Adults can make your decisions, but in kids, it's been a problem. And so City Council, probably about a year ago, outlawed flavors in vaping, which was an important step. So you can't buy cotton candy vape products in Chicago anymore. We are hoping that City Council will work to actually outlaw flavors across all tobacco products, which would be good. But we've also, this work of really educating folks and having some funding to do that has been really important. And there's a follow-up question here. Someone's asking about settlements for the opioid crisis. And that's been a series of really national lawsuits, but the city of Chicago has participated, as has the state of Illinois. And Chicago is going to be receiving about $78 million over 18 years. Specifically, CDPH is getting this money to address the ongoing opioid epidemic. Settlements with the 3 largest pharmaceutical distributors, with manufacturers, with some of the pharmacies, et cetera. And it's bringing, our needs around opioids are huge in this city. There are more Chicagoans every year by a lot who are dying from an opioid overdose than are dying from all gun-related violence and car crashes combined. And it's continuing to just be at these historically high levels. So on the vaping front, it's a lot about education and helping try to stop kids from getting started. On the opioid front, certainly there's prevention work to do, but there's also just a huge amount of need for treatment, better data around where we're starting to see fentanyl in the drug supply, et cetera. So we might bring next week, since we have a behavioral health focus, I think we might talk a little bit more about opioids and even the settlement next week to pull that in. Faith State on Facebook is asking, what's happening with the nasal vaccine? So there is still research going on there, but at this point, we've not had a nasal spray version of a COVID vaccine sort of come to market. I think once we know a little more about whether this is going to be something that we're needing to do an annual vaccine for, where there's some more predictability for the companies that do the research and produce these. Just like we've seen a nasal version for the flu vaccine emerge over time, I think it's likely that we may see a nasal version of the COVID vaccine. But at this point, there's not a version that is available. And there's just a follow-up question. COVID vaccines are all still free. I want to emphasize that too. I mentioned it on the testing side, but COVID vaccines are free, and even as the public health emergency is projected to end in May, I actually anticipate COVID vaccines will remain free for some time because we have quite a large stockpile. The U.S. government purchased a lot of vaccine. Here in Chicago, we've worked hard to make sure that free vaccine is distributed, and so come up to date for sure, but it's not like in May, vaccine will automatically become something that you have to pay for. But I do think as we look ahead towards the fall, vaccines, I expect for people who are insured, will remain free of charge. Generally, when a vaccine is recommended by the ACIP, the Committee on Immunization Practices, we have protections now that basically say, you're not supposed to have to pay co-pays, you're not supposed to have barriers to preventive care, which is what vaccines are. are. And so if you have commercial insurance, my anticipation is that COVID vaccines will remain free for you. But who I'm worried about are people who are underinsured and then uninsured, and what that will look like. And I don't have answers to all of that just yet, but it's something we're planning around as a health department and as a country as the emergency ends and there isn't dedicated funding for COVID, any new dedicated funding for COVID to help pay for testing and vaccines and treatments and all of the work of the health department, how we make sure we maintain some of that. And vaccines are critical for preventing illness, but also from stopping hotspots from occurring. And Catherine Zuriabita from Facebook is asking, where in the world are COVID hotspots at the moment? Thanks. Yeah. So I think we actually do have a link to this on our website. We look every week. We're looking at the WHO and others. It's sort of like, you know, that map I showed you of the U.S. that's mostly green, and then you'll see these scattered little hotspots. That's actually what COVID is looking like worldwide as well. It's not like we're seeing whole countries that are really blowing up or out of control. We're seeing regions sometimes within countries that are sort of having a relatively contained, especially historically, COVID outbreak. There are some in Asia. There are some still going on kind of in that Australia, New Zealand area. And then there are scattered in Europe, particularly Eastern Europe. But that really changes a little bit week to week. But I want to emphasize that it's not like it was in the first few years where you'd see a hot spot take off and then kind of quickly envelop a country, a region, the world. That's just not how COVID is behaving right now. And so where we're seeing quote unquote hot spots, you know, China certainly, when they made those changes in their policies a few months ago and stopped trying to aim for zero COVID because it's really just not possible. Certainly we saw some big surges of disease with that because there was a lot of population that had not previously perhaps had COVID and had not even had vaccine in some cases. But that even that has started to cool. It's a little hard to get data from China, but as best we can tell, that looks like it's cooling. So there's no part of the world that is having kind of a major outbreak where we see disruption of medical care. You know, Ukraine, for example, that is always a setting where you can see more problems with infectious diseases, COVID being no exception. And so there are some other hot spots kind of around the world if they have war or unrest, though very often infectious disease outbreaks follow that. We'll see one of the reasons we haven't managed to get polio quite eradicated is that in parts of the world that are still having really, decades-long wars, it's really hard to get the vaccine campaigns out there. And that mix between infectious diseases and sort of unrest is one that goes back millennia, and we see it here too. So if you check the WHO page, that's probably the best place to see what's happening up to date. But if we see anything major, actually this is a good point too. We also actually look at travel patterns. So my epidemiologists at the health department are pulling in data, and we look at sort of where are our international flight patterns like, what comes into O'Hare especially, but Midway, where do those flights come from? And for any significant infectious disease, any emerging issue, we're not just saying, oh, there's a problem like there is right now with chikungunya in Paraguay. That's a mosquito-borne disease if you don't know about it. Yes, we know about that because it's Paraguay, and you want to make sure if there are travelers to Paraguay that, our healthcare providers know that. We do some, to healthcare providers focus. But in addition, we look to see what are the flight patterns like from Paraguay, like how likely are we to get the introduction of a disease or a new variant or whatever the case may be. And we're not seeing anything in terms of those sort of global patterns of major concern on the horizon either. So a little more than you asked, but that's the kind of behind the scenes epidemiology work that I think a lot of people don't realize that we do here in Chicago, but also really around the country. And those global patterns, there's the CDC has a whole section that's focused on global disease and global migration and quarantine, and we work closely with them because obviously diseases can spread really quickly. And then I think maybe just because I promised you we'd wrap up on time today, Lisa on Facebook is saying, with this 3-year anniversary of COVID, is there anything you would have done differently early on? Anything you would have said differently? What are your concerns around COVID at this point in the pandemic? So first of all, I've been getting different versions of this question in all kinds of different settings right now. And I really do stand by the things that we shared and messaged about COVID at every point throughout this pandemic. Are there things we know now about COVID that if we had known at the beginning, we would have messaged differently? Of course. The biggest one is probably we didn't know that you could spread COVID before you had symptoms. That's not how the other coronaviruses had showed up. That's not how, Ebola and some of the other kind of emerging diseases we've dealt with recently show up. And so in that setting, if you can't spread COVID until you have symptoms, just a lot of if that's the assumption, a lot of the early, the early messaging about how to protect yourself, even the early conversation about masks, right? If you always can know that you have symptoms when you have COVID, you perhaps don't need to be doing the universal masking. You only need to do the mask when you have symptoms. It was when we really learned that in fact you can spread it before you know it. I mean, understanding that put this in it made it basically a disease that we can't eradicate, to be perfectly honest, and that you need to use a range of different approaches. But so there are things that I know now that I look back and I say, if we had known that, of course, we would have messaged on some of that initially. But what I can tell you, honestly, is that at every single point over the last 3 years, I and my team worked really hard to be up to date with what we knew about COVID at that point, to make sure that reflected what was showing up in Chicago, right? Not just reporting what are we seeing nationally, but what does this look like in Chicago? Are we following national patterns? What's happening internationally? We had a lot of focus on travel in those early days because so much of, we did have this sort of effect that a hotspot over here would come and, be a hotspot here, and how do you control some of that? And so, honestly, there are things that I look back at, but there's nothing that I would have changed in the moment. We tried to couch a lot of our language. It's funny, I went back and looked at some of our early press conferences, and I was like, oh yeah, we were pretty good there in terms of saying, based on what we know now, this is what the risk is. But there was so much we didn't know. Remember that at the beginning, we weren't even entirely sure how this spread, right? So in terms of sort of some of that messaging and the direction, honestly, I can say with an absolute straight face, at every point here, I was able to use what we best know and turn that into messaging for all of you. So there's nothing really that when I look back, I say, oh, I would have messaged that differently. I do think that we've learned a lot about what it means to be prepared, not just as a city, but as a country. And that Chicago, thank goodness, we had a really strong public health emergency preparedness program at CDPH that had done a lot of work around exercising and plans, and stockpiling, right? Like, we had millions of pristine N95 masks ready to go for healthcare when this broke out. I had no idea how unusual that was in this country. But there was a lot we didn't have, right? We didn't have testing infrastructure, and we didn't have lab infrastructure that we needed. We certainly didn't have things like wastewater, even though that was a technology that existed, and we'd looked at using it for opioids and other things. We didn't have the funding to be able to put it in place. We didn't didn't have the staff for sure to be able to quickly redeploy toward an emerging infectious diseases. We didn't have the funding going to community partners to make sure that we've built that network of people who can all the time be working on the issues that the Chicago Department of Public Health works on, but also in a crisis, you can very quickly repurpose to do your door-to-door building trust, vaccine ambassador, work. And I'm worried looking ahead to this, what are your concerns around COVID? Always on the virus side, I have to remain worried about the way we may continue to see mutations and the possibility of a new variant. With every passing month, my worry around that drops. I'm the happiest person out there that it's been all Omicron for the last 15 months. Because if the enemy holds still, we can develop what we need on the prevention and treatment and societal side to fight that enemy. But if the enemy is always changing, right, it's very hard to keep up. So that's always going to be something I worry about. But really looking ahead, it's about, have we as a country actually internalized some of these lessons of COVID? And I think in some cases we haven't, just to be perfectly clear. I was really pleased to see Governor Pritzker, signing into law some of the required leave for workers. The fact that we still have people in this country, in this state, who don't have sick pay, right? Like, how are you supposed to stay home if you're sick? Which is like the #1 rule of preventing infectious diseases. Like, if you're at risk of losing your job. We thought about essential workers in really different ways. We thought about equity, right? And how infectious diseases really highlight a lot of where we are not doing very well as a society, where you see a disease show up differently in different communities. That has to do with resources and with all of the root causes that are already showing up differently in this city. And then I think also just, we've built some amazing things here in Chicago to protect the city of Chicago's public health. And I don't have a funding path beyond a couple years from now, right? Because we've always funded in this country, we have a tendency to wait until the emergency happens and then put a lot of resources around that single disease in the case of public health. But it makes a boom and bust funding cycle, so that when Ebola came, we built a lot of laboratory and other resources, and then that funding ran out and we took them apart. And Zika came, and H1N1 came, and COVID came. And my worry is that the health department does not need the very high level of expenditures, of course, that we needed at the height of COVID. But we do need to maintain some of what has been built. And if we don't create structures to do that at the federal, state, and local level, we're going to be right back to where we were. And that's just not acceptable. It's not acceptable to me. And I hope that it's not acceptable to you either. And so I really, when I think about my work in COVID going forward, yes, we will continue to deal with whatever is happening on the disease side. But a lot of my work over these next couple of years, I see to really be this kind of fighting for making sure that public health departments here and across this country have some of that basic human data and response architecture in place. We've built it, and it would really be a bad move to completely dismantle it. I want to be able to fund a community health worker to work on diabetes and connecting people to insurance and mental health and violence prevention, the things that the health department works on all the time. I want to be able to fund that because it's funding the most important work to get at a lot of those root causes, but it also gives me a workforce that we could turn to that already sees itself as part of public health and that is based in communities and trusted by communities. And we're gonna figure, the Healthy Chicago Equity Zones. Last week we had folks on talking about that kind of work. That approach, I think, is just as important as whether your city has masks stockpiled. Be glad you live in a city where we take all of that really seriously, but I'm worried that the national conversation is going to get stuck around, do you have stuff stockpiled? And yes, that needed help at the national level, but the conversations about infrastructure and personnel, I don't think are happening in the same ways that they need to. And we just have to do a better job at making sure we have an all hazards preparedness approach. We never got money for monkeypox. Thank God there was some COVID funds, but officially I couldn't even use COVID dollars. I had vaccinators who were funded only to do COVID vaccine. I wanted to switch them to do monkeypox vaccines. Legally, officially, I couldn't. That doesn't make sense. You build vaccinating infrastructure, you build nursing infrastructure, you build community health and community education infrastructure, you build epidemiology and data infrastructure. You build that not for a single disease. You build that so that we can monitor and respond to all of the low-level things that are happening all the time, and so that we are ready and we catch and we can respond in the unlikely, but not entirely out of the realm of possibility situation that we have another emerging infectious disease. That polio shows up again. It happened in New York. We have to be ready for that. And I got a little worked up there, but I am, when I think about COVID, I'm not so worried about what happens tomorrow or next month. I'm worried about the public health infrastructure that we've built and whether we'll sustain that as a country. So with that, thank you. There's a few, I see West Loop Tom on Twitter asked, will Dr. Arwady be staying on for the new mayor? Let me just address that. My intent is very much to stay on in my role. That is the call of whomever our next mayor is. But the work of the health department doesn't change very much regardless of who the mayor is. Obviously, that work fits into different structures, and certainly different leaders will prioritize different things. But by and large, the work of making sure that every restaurant and place that serves food in this city has the appropriate inspections and the food protection that needs to be in place. The work of lead poisoning prevention, making sure that every child with even a mildly elevated lead test is getting the care that they need, but also the inspectors are going in and figuring out where is the old lead-based paint and let's get that fixed. The environmental work of protection, the work of our nurses in our WIC clinics, our women, infant, and children clinics that support nutrition for pregnant people, nursing people, young children. All of that isn't going anywhere. Our sexually transmitted infection clinics and work, all of our HIV work, where we're making sure everybody in this city can both get the treatment that they need if they're diagnosed with HIV, but more importantly, get the medications and the care to help keep them from becoming positive in a prevention way. The mental health work and working to build systems. You know, the Chicago Department of Public Health makes sure that all the kids in CPS get their vision checked and get glasses. We make sure that they get their teeth checked and are able to get the treatments that help keep dental care, knowing how many kids don't get the dental care that they need. There is a lot of behind the scenes work. Our newborn baby work, Family Connects. We've got a goal where every baby born in this city, that family is being offered a nurse home visit within the first few weeks after giving birth to make sure that the mom, the baby, but also the whole family have the resources that are needed. I could go on and on and on. All of this work continues, regardless of who the mayor is. I, of course, am hopeful to continue to lead this work. I love my team. I love my work. I love working at the local level in public health. I've had opportunities to leave and have chosen not to take them. And so we'll see. But, I do think that people recognize good work when it's happening. And I think the Chicago Department of Public Health does really amazing work. So my intent is to stay on, but we'll see what happens with the new mayor. So thank you all very much for your time and your questions and attention as always. Next week we are planning, we'll do a bit on COVID, but then we're planning to do a little more of a deep dive on behavioral health. That's our mental health work, some opioids work. We'll probably talk about that settlement for those of you who had questions there. And perhaps if we have time, a little bit on the violence prevention and intervention work. So that'll be March 21st at 11 a.m. We're not doing Facebook Live on March 28th, and then on April 4th, we'll be doing a focus on sexually transmitted infections. We've got guests for both of those. So in the meantime, be well, and if we didn't get to your question, we will look to get it addressed on the website or bring it up next time. Thank you.